Hi, I'm Emma. I'm one of the clinicians working here at Lloyd's Pharmacy Online Doctor. Today, I'm here with a step-by-step guide for successfully taking a blood sample. You might be wondering why we would need to take a blood sample in the first place. Well, some of our test kits require a sample of your blood to test for certain infections like HIV or syphilis. Collecting a blood sample involves using a pinprick device called a lancet to draw blood from one of your fingers. This isn't usually very painful, but it can be quite tricky, especially if you're collecting the sample for yourself. So I wanted to give you some advice on the best way to collect your sample. First, open your test kit and get it ready on a clean, flat surface. Ensure you take out the blood sample collection tube and remove the cap. Stand it securely in the closed packaging. Next, wash your hands in warm soapy water. Collecting the sample is usually easier when your hands are warm. You could even take a shower or a bath before, or simply run your hand under warm water for a couple of minutes. Once your hands are dry and clean, choose which finger you would like to use. It's usually best to use the hand you don't write with. Use the Alco-Tip wipe on the chosen finger and then wipe dry with a clean tissue. Ensure your finger is completely dry. At this point, it's important to try and relax. We recommend doing the test standing up and to keep your hand below your waist. Twist and remove the tip from the lancet. Press the lancet firmly against the tip of your finger. You will feel a small prick and a small drop of blood will form. Wipe away the first drop of blood with a clean tissue. Massage your finger from the knuckle down to encourage the blood flow. Allow the drops to fall into the blood collection tube. It's important to fill the blood collection tube to the upper line on the side of the tube. If you're struggling to get enough blood, you can use another lancet on a different finger. Once you have filled up to the top fill line, push the cap firmly back onto the tube. If you don't get enough blood, the lab team might not be able to process your blood sample, and you may have to repeat the test. So it's important to try as hard as you can to get to the upper line. Once the tube has enough blood in it, gently turn the tube upside down 5 times. Ensure you label your samples and place the collection tube in the protective packaging wallet. You can then send your samples off to the lab. Once they're there, you should have your results in 2 to 3 working days. I hope you find this helpful. Thanks for listening.